Yes.
Ayun, meron na. Okay, recorded na. Start na tayo. Okay, good morning, Andy. We start. Pray muna
Visible na
tayo.
siya. May tanong ako.
Yes. Ano yung tanong mo, Ber?
Ay, wala natin. Naka-start record ka na pala. Sige na.
Sige. Okay. Lipitin ko ha. Good morning, Andy. Open ko na lang yung camera ko para kita niyo. And mag before we start, let's mag-pray muna tayo. So, mag-lead ko na yung prayer. So, Lord God, thank you for this day na nag-meet po kami. Kayo po ang siyang mamuna sa aming gagawin. Make me na may deliver ng maayos yung topic and sana rin po maging good listener din po yung mga students. All these things we ask in Jesus' name, amen. So, check muna ako ng attendance, no? Miss Veronica, are you
Present po.
Mr. Charles Garcia, are you here? Mr.
Yes,
Charles, are you here? Next, Miss Jess Garcia. Okay, thank you. Miss Hyacinth Garcia,
Present, ma'am.
are you here?
Present po.
Miss Christine Pelages, are you here? Miss Pelages?
Present, ma'am.
Okay, thank you. Miss Ana Santos, are you here?
Present, ma'am.
Next, Miss Dina Ayora,
Present, ma'am.
Miss Dina Payoran,
Present.
okay, thank you. And last, Mr. Yeah.
Present, ma'am. Present po.
So, can you tell me what can you see in the first picture? Miss Veronica Rose. Can you please tell me what can you see in the screen? Miss Veronica Rose.
Wait, ma'am. Wala po ako makita sa share screen.
Okay, wait lang na.
It is a structure of the breast, ma'am.
Okay, very good. As you can see, it is the anatomy, no, of the breast. So there is a lymph node there, the skin, the milk gland, milk duct, reservoir, pots, ribs, and muscles. Okay, thank you, Miss Veronica Rose. Next picture, who can tell me what's in the screen? Yes, Miss Hyacinth Garcia.
Breastfeeding po.
Okay, thank you. Very good. So, there is a mother who breastfed her baby. Next picture. Can tell me what you can see in the screen. Anyone else? What you can see in the screen. Can I ask, or may I call Miss Christine? Yes, Miss Christine. Are you there, Miss Christine? Anyone else? Yes, Mr. John Charles.
Mama picture of the baby.
Yes. And it tells there, I am a breastfed baby. So, as we can see, there is a benefit na makikita rin natin for being a breastfed baby. One of these is better brain development. Another one is better vision. So breastfed really benefits a baby. It can also have a baby a healthier heart, less tummy trouble, fewer food allergies, fewer ear and respiratory infection, fewer skin allergies, less eczema. So those and also significant reduction in the risk of SIDS. So as we can see, there are many benefits not being a breastfed baby. Are you a breastfed baby? Or are you not sure?
Breastfeed baby po.
Oh. So those pictures from the anatomy of the breast, from the mother breastfeeding the baby, and from the baby who's being breastfed, those pictures will talks about our topic for today. So those pictures are related from our topic for today. So breastfeeding provides newborn and infants with a complete source of nutrition for the first 6 months of life. As children grow, breastfeeding continues to be a nutritious part of a child's diet alongside the addition of solid food. So breastfeeding really helps the baby, no, from the first 6 months of his life or her life. So breastfeeding has a complete source of nutrition. So, it was a full package na rin, no, for nutrition na rin ng baby. Breast milk helps keep your body healthy. So, the breast or the milk from the breast is called breast milk. So, this milk helps your body healthy. It protects against allergies, sickness, and obesity. It protects against diseases like diabetes and cancer. It protects against infections like ear infection. It's easy digested, no constipation, diarrhea, or upset stomach. So it is very advisable not to breastfeed the baby because those those infections or cancer diseases na can acquire will be prevented na if we are breastfed or if we are breastfeeding or breastfed baby. Next is lactation. So lactation is the period of milk production by the mammary glands. The preparation for lactation starts during adolescence and when hormonal changes bring about the development and increase in size of the breast, areola, and nipple. So when a breastfed mother nasa stage na of lactation, there is a changes from its breast na. So, her breast may be bigger, ganon. Your and also the areola and nipple will begin to increase in size. So lactation is maintained by regular removal of milk and stimulation of the nipple, which triggers prolactin release from the anterior pituitary gland and oxytocin from the posterior pituitary gland. So the two main hormones responsible for milk production are prolactin and oxytocin. So this prolactin is a hormone that it stimulates milk production. So prolactin is very helpful from stimulating milk. Suckling is a major stimulator of prolactin secretion. Prolactin levels doubles with suckling. Next is oxytocin. So this oxytocin release is also stimulated by suckling or nipple stimulation. Its main role in letdown or ejection of milk from the milk gland, especially the acinus, into the milk ducts. So aside from what I say from a breastfed mother, they also pose to have a problem, no, for having a breastfeeding. Here are the common breastfeeding problems. So we have the sore nipple, flat or inverted nipples, letdown failure, hyperactive letdown, hyperlactation, engorgement, plugged duct, low. So who can read the first sentence? First problem of the breastfeeding problem. Can you read it for me, Miss Ara Santos? Can you please read it for me,
Yes, ma'am. Sore nipples.
Miss
ma'am.
Ara? Okay, that's right. Thank you, Miss Ara Santos. So, sore nipples, early mild nipple discomfort is common among women initiating breastfeeding. In most women, the discomfort is transient and usually subsides by the end of the first week. It is, however, not uncommon for some women who experience nipple pain lasting a month postpartum. Severe nipple pain, the presence of nipple cracks or fissures, pain that persists throughout the feeding, or pain that is not improved by the end of the first week should not be considered normal and requires a detailed evaluation. So, as early as first week, let's observe, no, for those mothers, or if you will become a mother soon, let's observe our nipple, or if you can, what do you call this? You can see, or you can feel a pain with your nipples, no? Because these sore nipples or pamamaga no, ng ating mga nipples will uh, not considered normal. So it requires detailed evaluation. Painful nipples and nipple trauma can lead women to become discouraged and depressed without or with breastfeeding. So these sore nipples, no, it can also affect those mothers to have a trauma, no, or they will be discouraged, no, or they will afraid to have a breastfeeding for their babies, because maybe they will feel too much pain, no, for their nipple. So this is one of the reason why why women, or why those mothers stop breastfeeding. As many as 1/3 of women who experience nipple pain and trauma switch to bottle feeding within the first 6 to 8 weeks postpartum. So that's it, no? So those women experiencing nipple pain, no, they tend to switch to bottle feeding because they are afraid, no, for the pain na rin. So as early as 6 to 8 weeks, no, they will switch to bottle feeding. The best prevention, no, of nipple pain and soreness is proper positioning of the baby on the breast. Maybe we can tackle or we can tackle more or deeper about the positioning of the baby for our next topic. No? So in order to feed effectively, the baby needs to draw the breast deeply into the mouth so that the mother's nipple approximates to the junction of the hard and soft palate. So we can also prevent those nipple pain if we know, or those mother have a knowledge or idea on how to proper position the baby on the breast. Next, can you please read the second problem? You can raise your hand, no, for if you want to recite. Yes, Mr. John Charles. Can you please read it for the class? And its definition also. Mr. John Charles. Are you there, Mr. John Charles? Yes, Miss Hyacinth.
Ma'am, still loading
Ay, okay,
po.
Mr. John.
I can't read the next problem.
You can't see the ano po, the screen? Yes, Miss Hyacinth. You can see the
Yes, ma'am. Flat or inverted nipples.
yeah.
Yun yung second problem.
Okay, thank you, Miss Hyacinth. So, next problem is the flat or inverted nipple. So, from the word itself, it is flat or it is very, so the nipple of the mother is very small or you can't, see the nipple na. So, flat or inverted nipple is a condition in which the nipple is pulled inward into the breast instead of pointing outward. So, it says here that instead of, let's go back to let's go back to the anatomy of the breast so that I can explain it more clearly. So here, so this is the nipple, you know the nipple, di ba? So instead of pulling outward down the nipple in flat or inverted nipple, it was pulled inward. So in other word, nasa loob yung nipple natin, inward siya instead of pulling outward. So in flat or inverted nipple, wait lang. Yan. Some women have flat or inverted nipple. I also have a friend who is already mother now, and her nipple is flat or inverted. And since the baby cannot find the nipple, no, they tend to switch to bottle feeding. So from day one, the baby was fed by bottle, no, but not by milk. So some women have flat or inverted nipples which do not extend very far into the baby's mouth. This should not impact breastfeeding if latch is correct. So it says here na nako-correct pa naman siya, no? Nako-correct pa naman in proper positioning lang, no? If the baby is struggling with latch, instruct the mother to roll her nipple between her fingers or use a breast pump prior to feeding to help draw out the nipple. Pero in fairness, there are some mothers na they, even if they have inverted nipples, no, they can create a way to have a milk, no, for their babies. So they use pump. You know the breastfeeding pump. The pump help. Thank you. The pump's used to help the milk to lumabas or ma-pump yung milk natin, no, para maano siya. Then afterward, the milk will then give to the baby. Next problem is the letdown failure. So, who can read the definition of this letdown failure? Failure, the first sentence there. Can you please read it? Who want to read it? Just raise your hand, class, so that you can have a recitation point. I am calling, no, Mr. Joaquin, so that I can hear your voice too. Mr. Joaquin, can you please read the first sentence?
Yes, ma'am. Letdown failure is a condition when milk does not eject with the breast.
Very good. Thank you, Mr. Joaquin. So, letdown failure is a condition when milk does not eject with the breast. Letdown failure is common, but because letdown is necessary to successful breastfeeding, it is important to address the matter. Stress may inhibit oxytocin as well as alcohol and distraction. So, stress, no, that is one of the problem rin. So, iwas-iwasan, no, sana ang stress. And also the alcohol intake, no. It can also distract those hormones to work well. Oxytocin nasal spray can be prescribed by a physician for letdown failure. The synthetic oxytocin is sprayed into the nose and stimulates letdown, but it can only be used for a few. Okay, next is the, can you please read Mr. Marvin Dicado? Can you please read next problem? Mr. Marvin
Yes.
Dicado.
Yes, ma'am. Hyperactive letdown. Sorry, ma'am, my sister is crying. Hyperactive letdown is the forceful ejection of milk from the breast during breastfeeding.
The Mr. Marvin Dicado. So, hyperactive letdown is a forceful ejection. Forceful ejection of milk from the breast during breastfeeding. Hyperactive letdown can also be a problem, especially among first-time mother. So, when letdown is overactive, milk streams from the breast as feeding begins. Milk may also leak from the breast that the infant is not being nursed from. So, based on observation from other mothers din, once they become a mother, it is very common to see na there is a breast leak na rin, no, or milk leak na rin on their breast. Na-observe nyo na rin ba yon? Yung mga damit nila basta gano'n kasi nag-leak. No? Na-observe nyo na rin ba yon? Or may kakilala na kakita na rin po ba kayo ng mga gano'n? So, this is the hyperactive letdown din, no? So, same as hyperlactation. So, hyperlactation is the condition where breast milk overflow occurs because of increase of milk production. So, hyperlactation naman is nangyayari siya because of overproduction naman siya ng milk. Hyperlactation occurs when the milk volume being produced by the mother far exceeds the intake of the baby. A hyperlactive letdown may be a sign of overproduction. So, some others really in things and down are deep. So, it can be done by having the baby nurse on only one side during feedings and having the mother express only. So cabbage leaves are also be used to decrease the. Next one is Miss Dina Payoran. Next problem. Can you please read it? Miss Dina Payoran. Are you there, Miss Dina Payoran? Okay. Maybe the signal is weak. I'm going to read na lang. So the next, okay, Miss Hyacinth, you may help Miss Dina Payoran.
Engorgement occurs when breasts are overfilled with milk. This is common during the first week of the birth and in first-time mothers. Engorgement occurs when the supply and demand process is not yet established and the milk is abundant. It also occurs when a frequent or ineffective removal of milk from the breast because of mother-infant separation, a sleepy baby, sore nipples, or improper breastfeeding technique.
Okay, thank you, Miss Hyacinth Garcia. So, engorgement occurs when breasts are overfilled with milk. So, it is very common no, during the first week of the birth and in first-time mothers. So, it also occurs with infrequent or ineffective removal of milk from the breast because of mother-infant separation, a sleepy baby, sore nipples, or improper breastfeeding techniques. So, the best way to prevent engorgement is to nurse the infant frequently. So newborn infants will often nurse every hour and a half. So that's the idea. Ideally, what do you call this? Interval. So if the infant is not available to nurse, expressing milk every few hours will prevent engorgement while helping to build and maintain a milk supply. So women can use analgesic to reduce pain from engorgement. A warm shower or warm compress. So a warm shower or warm compress with massage before feedings may be helpful to relieve pressure and trigger milk flow. So when you're going to take a bath, or you can advise those mothers din no, nakakilala nyo no, to para ma-ease din yung pain na nararamdaman nila. They should take a warm shower or warm compress, then they can massage no their breast, and it is very helpful to relieve the pressure no and trigger milk flow. Application of cold compress or gel packs between feedings helps to reduce pain and swelling. So the cold compress also helps no to reduce the swelling and the pain. The last, I think this is the last, or no, second from the last. Can you please read? Who want to read the next problem? Anyone who want to volunteer to read the problem? Anyone from the class? You can raise your hand to have a recitation for this day. Anyone? Miss Hyacinth Garcia again.
Next is plug duct. Plugged milk duct, also called closed milk ducts or blocked milk ducts, are hard, tender lumps that form in a narrow milk ducts or of the breast. Unobstructed or plugged duct is a localized blockage of milk resulting from milk stasis or milk remaining in the ducts. The mother may feel a painful knot in one breast but usually does not have a fever or other signs of illness. Treatment for plugged ducts is gentle massage, warm compresses, and complete emptying of the breast. Women should consider changing nursing position to facilitate emptying of the breast. That's all, ma'am.
Thank you, Miss Sia. So, I will just explain some, no? So, this plug duct or the clog duct, in Tagalog term, it is the duct or the canal, no, of the milk is barado. So, the milk is nahihirapan siya na maka-flow ng maayos. So, as a result, the mother will feel pain, no, for their breast. And but this pain can cause or don't have a signs, no, of illness. Then the treatment for plug duct is gentle massage. So it is very helpful talaga to massage their breast then to prevent those problem, no. Warm compress also big help, and complete emptying of the milk. So mothers should consider changing nursing position, no. From time to time, they also need to change the position, no, for the baby. Why? Kasi kung isang part lang, no, if one part of the breast lang yung nagpa-function or pinagdededehan ng baby, no, na napupuno yung siya na empty. So baka isa rin yan sa nag-cause ng pain or ng pagbabara. So it is advisable to change position, no, from time to time. For example, if woman is nursing while lying down, she may try a sitting position or she may switch the position of holding the infant. Yun. If woman is pumping, the flange size should be assessed. In most cases, using a larger size flange will improve efficiency of pumping when plugging occurs repeatedly. A gentle manual massage before nursing often results in the plug being expelled. Consider use of lecithin for chronic plug ducts. Last one, I think this is the last problem. No? May I ask again Mr. Joaquin Ventinilla to read the last problem for that class? Are you still there, Mr. Joaquin? Some students are experiencing a very, very poor signal. I think Miss Hyacinth Garcia, no, has a good connection. Okay, yes, Miss Hyacinth Garcia. Please,
Yes, ma'am. So lastly, low milk supply. In this condition, milk supply of the breast is considered low win. Sorry, ma'am. Ulitin ko po. In this condition, milk supply of the breast is considered low when there is not enough breast milk being produced to meet the baby's growth needs. Real or perceived insufficient milk supply is the most common reason for cessation of breastfeeding. Low milk supply is usually caused by the mother not breastfeeding or pumping often enough, or inefficient emptying of the breast caused by a poor latch or incorrect flange size while pumping.
Thank you, Miss Hyacinth Garcia. No? So the last problem is the low milk supply. Or from the word itself, low. So very little lang yung milk supply ng mother. So hindi enough, or the milk is not enough to produce or to meet the baby's growth needs. So, real or perceived insufficient milk supply is the most common reason for cessation of breastfeeding. Low milk supply is usually caused by mother not breastfeeding or pumping often. So, when the mother usually or not frequently do breastfeeding, so it may cause for the low milk supply. So that's all. Do you have any questions, class, or clarifications before?
None.
None, ma'am.
Okay. If wala na po, I want you to take down notes, or I will just send it on the group chat, your assignment. I want you to draw the anatomy of the breast on a clean and long cotton or bond paper. And I will announce na lang the date of submission. So, if you have no questions, I will end this lecture. Or okay, thank you, class, for listening and participating, and goodbye.
Thank you, ma'am.
Bye, ma'am.